How do gastroenterologists treat small intestine issues? Have you ever wondered how specialists tackle problems in the small intestine? Gastroenterologists are the doctors who focus on digestive disorders, and they have a variety of methods to address these issues. The small intestine can be tricky to examine due to its length and location, but gastroenterologists use advanced tools to get a clear picture of what is happening inside. One of the first steps in diagnosing small intestine issues is through advanced imaging and endoscopic procedures. For instance, capsule endoscopy allows patients to swallow a tiny camera that captures images of the small intestine lining. This method is especially useful for areas that traditional endoscopy cannot reach. Another technique is double balloon enteroscopy. This specialized endoscopic method uses balloons to help advance the scope deep into the small intestine. This allows doctors to see, biopsy, and treat problems like bleeding lesions or polyps directly. Standard upper endoscopy, also known as esophagogastroduodenoscopy, can examine the upper part of the small intestine, but it has limitations beyond that. Once a diagnosis is made, the treatment plan depends on the specific issue. If there are bleeding vascular lesions, gastroenterologists can use cautery techniques through the enteroscope to stop the bleeding. They may also place small metal clips to control the bleeding effectively. For polyps, gastroenterologists can remove them endoscopically using snare techniques during enteroscopy. However, if the lesions are difficult to access or if endoscopic treatment is not enough, surgical intervention may be necessary. This could involve intraoperative enteroscopy, where the small intestine is examined and treated during surgery, or segmental resection of the affected bowel. In cases of inflammatory or ulcerative conditions, such as Crohn's disease or medication-induced ulcers, gastroenterologists often use medical management with appropriate medications. They frequently collaborate with other specialists, including surgeons and radiologists, to provide comprehensive care, especially for complex cases like tumors or severe bleeding. The practical applications of these treatments are significant. They can stop obscure gastrointestinal bleeding, remove precancerous or cancerous growths, manage inflammatory diseases, and improve nutrition when absorption is affected. In some cases, nutrition support may involve placing feeding tubes or administering intravenous nutrition when necessary. In summary, gastroenterologists treat small intestine issues through a combination of advanced diagnostic tools and targeted therapies. This approach allows for precise diagnosis and minimally invasive treatment of many small bowel disorders, ensuring patients receive the best possible care.